Are you or someone you love taking medication for anxiety, insomnia, depression, or even bladder problem? Some of the most common pills in your medicine cabinet could be quietly increasing your risk of dementia by as much as 50% if taken daily for just 1 year. What are these group of medications? This group of medication we are talking about is called anticholinergic. This medication blocks a neurotransmitters in your brain called acetylcholine, which is essential for memory learning and muscle function. When you block acetylcholine, you may get relief from your symptoms, but you could also be putting your brain at risk, especially with long-term use. Common anticholinergic drugs include some over-the-counter allergic medication like diphenhydramine found in Benadryl, sleep aid like deoxylamine found in unison, certain antidepressants like aminotriptyline and paroxetine, medication for anxiety, drugs for overactive bladder like oxybutynin and totarodine, some antipsychotics and muscle relaxants. You might be surprised to find this in your medicine cabinet right now. Some recent studies have shown that taking strong anticholinergic drugs daily for just 12 months can increase your risk of developing dementia by up to 50%. That's a huge number, especially since these medications are so common and often taken for years. The risk is highest in older adults, but anyone can be affected. The longer you take these drugs and the higher the dose, the greater the risk of your dementia. The effect can be permanent even if you stop taking the medication in some cases. How do anticholinergic affect your brain? Acetylcholine is a chemical messenger that helps your brain cell communicate. It's crucial for memory, focus, and learning. When you block acetylcholine, your brain can't function at its best. Over time, this can lead to memory loss, confusion, and eventually dementia. Here are the symptoms of anticholinergic side effects: brain fog or confusion, memory problem, trouble concentrating, drowsiness or seduction, dry mouth, constipation, and blurred vision. If you or a loved one is experiencing these symptoms, it's important to talk to your doctor. Here are some of the most common anticholinergic medication you might be taking. For allergies and cold, Benadryl or chlorotrimethine. For sleep, deoxylamine or unison, and diphenhydramine. For depression and anxiety, amitriptyline and paroxetine or dosepin. For bladder problem, oxybutynin, ditropan, and ditro. For muscle spasms, cyclobenzaprine. If you see any of these names on your medication list, don't panic, but take action. Let's talk about safer alternative. For allergics, try non-sedating antihistamine like loratadine or claritine. For sleep, focus on good sleep hygiene, melatonin or cognitive behavioral therapy for insomnia. For depression or anxiety, ask about newer antidepressants with lower anticholinergic effect like sertraline. For bladder, newer medication and non-drug therapies may be available. For pain and muscle spasms, Physical therapy, stretching or non-anticholinergic medication can help. Now let's talk about natural remedies. Besides talking to your doctor about safer medication, there are natural ways to protect your brain and lower your risk of dementia. Stay physically active. Exercise helps increase blood flow to the brain and support memory. Eat a healthy diet like leafy greens, berries, nuts, fatty fish, cod liver oil, and whole grains. Get enough sleep. Poor sleep is linked to memory problems. Challenge your mind. Read. Learn new skills. Stay social. Connecting with friends and family help keep your brain sharp. Manage stress and consider natural supplements. Some studies suggest that omega-3 fatty acid, turmeric, and certain B vitamins may support brain health. Always check with your doctor before starting any new supplement. Limit processed food and sugary food. Eat balanced diet. Small changes in your daily routine can make a big difference in protecting your memory for years to come. Indeed, learning never ends. In case you don't know me, I am Chinenye Harriet, and if you like natural remedies, like, share, comment, and subscribe to my YouTube channel. Don't forget to click on the notification bell. Thanks for watching and see you in my next video.